Hi, my name is Birdie Stevenson, and this is my skill video number 4 on CPR. So, the important thing to remember about triage is your A, B, and C's. A stands for airway, so if you have a patient that is crashing, we'll be using this. It's a weird mixed breed of some sort, I'm sure. You need to check their airway and make sure that there's nothing obstructing it, because if there is, then obviously they can't breathe, and that's not good. And then the second is breathing. So are they breathing? You can check and hear if they're breathing by listening to their chest with a stethoscope or by putting your hand near their mouth and nose and seeing if you can feel the breaths. And if they're not breathing, then obviously it's an emergency and something needs to be done post-haste. And then the next is circulation. So is their blood circulating like it's supposed to be? So to check that, you can lift up their gums and check the capillary refill time on that, and you can, that's my cat, and you can check to see if it refills within the amount of time it's meant to, and also if their gums are turning blue, which would be cyanosis, and that would mean that they're not getting the oxygen they need to, so that's an emergency and something needs to be done. And the best way generally to provide CPR on canine, if it's not a neonate or very, very small, is to have it laying on its side, and you can see where its heart is by bringing its leg back, and where its elbow touches its rib cage, that's where its leg will be. And so you put the heel of your palm on the rib cage and you press down as hard as you can, like this, making sure to keep your elbows locked, so don't bend your elbows. And if you hear things crackling or it seems like you're pressing really hard, then you're doing it right, because you need to compress it really hard. And then once you've done 30 compressions, generally speaking, so you do rounds of 2 minutes, and every 30 seconds you stop, and if you're by yourself you stop and cup your hands around their muzzle and nose, make sure it's a good tight seal, and give 2 rescue breaths, like, and you want to make sure that it fully, as much as you can, inflates the lungs, so put some power behind it. It's better to make sure they get that oxygen than not. And then, but if you were with other people, you would stop your compressions and have them do it. If you're by yourself, you can do it. And then you would continue as you had been doing before. So yeah, I think that's it. Thank you.